We are back with Dr. Ali Hassoun, an infectious disease specialist from Huntsville Hospital.
Dr. Hassoun, as the number of tests increases, we're seeing more testing sites opening up, including Huntsville Hospital's site at John Hunt Park. Do you think more people will get tested? Do you think more people should get tested, even if they don't show symptoms?
Yeah, so I think this is really good news to have more opening of a drive-through facility for testing. I think it's very important to do it because what's happening, if we can find these patients early in the disease, or even if they are asymptomatic, we might be able to track and trace these ones and ask them to quarantine. Hopefully by doing that, we can reduce transmission to others, and by doing that, we'll reduce the cases as well with time. It's gonna take time, but testing is always needed more and more. And I can tell you, with opening the sites, it's great, but we're gonna need more and more of that.
Some health experts say that pool testing is the next logical step in the testing process. What do you think would be an effective measure, and why or why not?
So, and the pool testing is an interesting idea, but I'm not sure at the time now when we have widespread community infection, the pool testing by itself going to be helpful, because if you know, the pool testing mean I'm going to get 50 people together, swab them and test all these swab at one time and see if there is anything showing up positive. If everything negative is good news, but if anything positive, then you're going to need to go back and screen each one of them. My main issue with this, if I have widespread infection, we're going to see a lot more. So probably pool testing when you have a widespread infection might not be helpful. It might be helpful actually, for example, in colleges, in schools, in where employee want to check whoever come back, or when you have cities and states where their level of their infection is low, and you think there might be a cluster that's coming up. That might be helpful in that, because you can save some of the swabs, but at the same time, you might not need to do each one. You do the pool and then screen accordingly.
Speaking of testing, what about antibody tests? Is that something that you would encourage people to get?
So, the antibody test is still a lot of issues around it. How much is going to be helpful to us? At the moment, there is really no good test to tell us there is active infection. The antibody tests only tell us there's been exposure. We're really going to need better tests to tell us how bad is the exposure, for example, what's the titer of response, is that going to be helpful in that patient if he have immunity with time, is that going to be helpful for us to use it and he can donate for plasma, for example. So at the moment, whatever we have antibody testing is really not ideal and not very, very useful. It just tells you you've been exposed to it. It doesn't tell you more than that.
Yeah.
Dr. Hassoun, taking into consideration everything happening right now, including the spike in cases, hospitalizations, and expanding testing, in your expert opinion, what is in store for the future of our communities here locally?
Yeah, I can tell you, my worry at the moment, if we're going to continue doing the same, we're going to see significant rise in the cases. So we really need to think, I don't know, as a community, as a state, to think about doing extra things in changing, reversing the reopening, or going to lockdown. If we don't do that, we're going to see significant increase. And my main worry with that is, what are we going to do about when is school coming, when the college need to be open, when the football season coming up? All these things, if this continue like this or getting worse, we're probably not going to be able to do it. That's why we need immediately, like now, we need to do a replanning for this. A way of, if the public doesn't follow physical distancing and masking, we've seen this over the last 4 or 6 weeks, we're going to need to do some lockdown and then gradually open if we see the cases go down. This is my honest opinion.
Yeah, nobody wants that, obviously. And you use the word if this, if that, if they don't do this, if we don't do that. So what is your final message to the people of North Alabama?
Yeah, and the message is going to be always the same. Please, as a community, you're going to need to think about your loved one, those friends, your community. We do not want to see increase and rise in the cases. We will not see, cases which is severe and people end up with strokes and heart failure and kidney issues. We don't want to see any death. How we can do that? By physical distancing. If you're sick, staying at home. If you have been exposed, quarantine yourself. If you cannot maintain physical distance, you do the mask. Or wherever you go in a closed space, put your mask on. Ask whoever around you as a family to put the mask on. Maintain hand hygiene. And please, you can do it. We've done it in March and April. And I think you can do it again. It's a matter of being patient, follow the rules, and hopefully we can do and go through all this together and, get through the end of the tunnel.
A matter of life and death for a lot of people. Dr. Ali
Yes.
Hassoun, thank you very much. Infectious disease specialist with Huntsville Hospital.
Thank you so much for your time and your insight tonight.
Thank you so much.
Stay with